2006 by establishing a 160A interlocal agreement that created New River Service Authority. Ingram doesn't mention North Carolina General Statute 122C-115.4, titled Functions of a Local Management Entity, which says the following: local management entities are responsible for the management and oversight of the public system of mental health. The primary functions of an LME are, and skipping down to function number 7, financial management and accountability for the use of state and local funds, and information management for the delivery of publicly funded services. Smoky Mountain Center knew that New River had financial problems in April of 2011. And they chose to do nothing. Smoky Mountain Center had a fund balance of $19,706,150 and could have worked with the counties to prevent this mess. But instead, they chose to let New River die and let the debts pass over to the counties. Then, at the last meeting, when commissioners left this room and went into executive session, Billy West from Daymark and Shelley Foreman from Smoky Mountain Center remained and were asked questions relating to the New River cars being given to Daymark. During the course of that conversation, Chairman Richardson's name came up. Shelley Foreman then proceeded to tell the group that she had worked with Ken, she calls him Ken, on numerous projects, and he was one of the finest, most concerned, and caring men she knew. She told the group that Ken had tried to rein in the spending at New River, and that this effort had angered Pam Andrews. And Pam Andrews had gotten the other board members to kick Ken off the New River board. Shelley Foreman said, "Read the minutes. It's all in there." Well, thinking I had, missed something, I reread the minutes. I don't know what minutes Shelley Foreman's been reading, but the New River Service Authority minutes I read don't bear out what she was telling the group at the last meeting. Chairman Richardson was not kicked off the New River Service Authority board by other board members. Chairman Richardson was removed from the New River Service Authority board by the Allegheny County Board of Commissioners for writing a letter to our state representatives on county commissioner letterhead, making it appear the other commissioners were endorsing his words. The letter in question, it reads as follows. February 22nd, 2010. Dear Honorable East and Stevens, for over 40 years, mental health services have been provided by New River Behavioral Health Care in Allegheny County. The state gave permission to New River Behavioral Health Care on a trial basis to become the first public multi-county provider of mental health services in our state. Public providers must maintain a high priority to serve the public as a whole versus being a solely profit-driven. If New River Behavioral Health Care is to succeed, the agency must be willing to involve board members and elected officials in the decision-making process. In recent weeks, I have received questions and or concerns from Allegheny citizens about New River Behavioral Health Care. Examples of questions/concerns from Allegheny County citizens are as follows. 1. Some citizens are questioning New River Behavioral Health Care's ability and willingness to provide quality mental health care in our area. 2, these citizens believe that the current quality of services is not being delivered to our citizens as in previous times. 3, Alleghany County has always had a local county director until the position was eliminated. The elimination of the Alleghany County's local director was done without any action of the New River Behavioral Health Care Board. The counties of Wilkes, Watauga, Avery, and Ashe all still have local directors. 4, in July 2009, 2 Alleghany employees who each had been employed with New River Behavioral Health Care for over 10 years had their benefits taken away. There were many other employees across the 5-county region that had their benefits taken away. The New River Behavioral Health Care CEO stated to the board that she had the sole authority to implement these benefit reductions. 5, Alleghany has one of the oldest offices in the 5-county program. The wood is dilapidated due to lack of maintenance. The roof is the original shingles and needs to be replaced. 6, the New River Behavioral Health Care decision to close the Elkin office was not discussed with elected officials in Surry County. This decision was made solely by New River Behavioral Health Care staff and was not approved by the New River Behavioral Health Care Board. To citizens and me, these are reasons there may be concern about the future services in Alleghany County. One of the original points of mental health reform was to allow for better local control, input, and choice on how to best provide services. If the state is to continue to allow New River Behavioral Health Care to operate as a public provider, the decision-making process must be examined. It should be cause for concern that decisions are being made without New River Behavioral Health Care Board involvement. At the January 2010 New River Behavioral Health Care Board meeting, I proposed establishing a committee for the purpose of communicating with officials in Raleigh. The CEO recommended to the board that this might not be a good idea because a board member might say something that the board may not want the Raleigh officials to hear. It concerns me that New River Behavioral Health Care staff is fostering an environment of censorship among elected/local leaders within the 5-county region. I have been a member of the New River Behavioral Health Care Board for 11 years and a county commissioner for 20 years. I am dedicated to making the mental health system better for all citizens. Alleghany County has demonstrated its dedication to mental health by funding services at a higher per capita rate than any other of the 4 counties. I look forward to meeting or talking with you about these challenges. Respectfully, Ken Richardson, Chairman. Mr. Richardson wrote this letter shortly after he was forced out as chairman of the New River Service Authority Board by a new accreditation policy that limited the term of the chairman, and his advocacy committee proposal being voted down by that board. If Mr. Richardson was concerned about the deficit spending at New River, why didn't he mention that in his letter to our state representatives? Instead, he writes about the Alleghany director's position being eliminated, the New River employees' benefits being taken away, that Alleghany facilities were old and in need of maintenance, and that the Elkin office had been closed. It looks like the New River CEO was the one trying to control spending, not Mr. Richardson. He goes on to talk about his advocacy committee proposal and how the CEO recommended to the board that this might not be a good idea because a board member might say something that the board may not want the Raleigh officials to hear. The following is what the minutes actually say about that. Quoting, Ms. Andrews asked if she could make a comment. Chairman Henderson then recognized Ms. Andrews. She stated that her concern was that the CARF standards need to be developed and a structure given to the board. She added that 5 different people don't need to be going 5 different directions. Clear communications is essential. She stated that the board could certainly establish an advocacy committee, but why then does the organization have a CEO? She added that the board should be careful of what it sets into place, and communication between those parties needs to be with those parties working together. She cited that the organization runs into danger anytime different ones are going and talking to people in Raleigh without communications and those people working together. End quote. The CARF Ms. Andrews referred to was founded in 1966 as the Commission on Accreditation of Rehabilitation Facilities. CARF International is an independent, nonprofit accreditor of health and human services. Mr. Richardson's letter goes on to say, quoting, Alleghany County has demonstrated its dedication to mental health by funding services at a higher per capita rate than any other of the 4 counties. I have yet to hear anyone explain why Alleghany County has been paying more than the other 4 counties. So, the CEO of Smoky Mountain Center, Brian Ingram, his view of the New River failure is the counties did it. The counties did it. And his sidekick, Shelley Foreman, says Pam Andrews kicked Ken off the New River board. I hope what sticks in your brains from what has been said so far is this. Can you really trust what the bureaucrats from Smoky Mountain Center say? And if you can't trust them, wouldn't it be in the best interest of the 5 counties to sever the relationship with Smoky Mountain Center? Now, changing gears to a somewhat different topic, I would ask you to consider the following question. Was our government created to oppress the people, or was the government created to be the servant of the people? At the last meeting, the county government tax office recommended that you as commissioners stick it to Mr. Collins, forcing him to pay for a mistake that was made by government. A mistake that he said he knew nothing about. The tax office seems to take the position that he should have known about it, even though Mr. Collins has agreed to pay the government's extortion tax. And that's what it is. The government says, pay us money or we will confiscate your property. No one owns their property. We just rent from the government. If I came to one of you and said, give me $1,000 or I'm going to steal your property and kick you out of your house, I would either end up in prison or dead. But back to Mr. Collins. Chairman Richardson has said that he was afraid of setting a precedent in this case. Why not set a precedent in favor of the people? Government shouldn't oppress the people. The people should get the benefit of the doubt. But if you take the advice of the tax office and you stick it to Mr. Collins and say he should have known better, then please apply that same standard to yourselves in the New River collapse. After all, you should have known. According to the 2006 minutes, the county manager, Lawyer Walker, and Chairman Richardson were involved in the writing of the 168 agreement. So they should have kept you informed to the potential liability the county faced. Chairman Richardson presented the 168 agreement to the Alleghany County Board of Commissioners and recommended that Alleghany County pass it and move forward. Chairman Richardson was Mr. 168. And since he is the chairman, each one of you should have been informed of the potential liability to the county. So the case can be made that you should have known, and some of you did and did nothing. So if you penalize Mr. Collins, you should apply that same standard to yourselves and the county manager, and penalize yourselves at the same rate on the total amount of the debt owed by Alleghany County as a result of the financial collapse of New River Behavioral Health Care. After all, you should have known and prevented it. If you stick it to Mr. Collins for not knowing, and don't apply that same standard of not knowing to yourselves in regards to the New River failure, then you will have successfully evolved into your typical, run-of-the-mill, hypocritical politicians. This isn't just about Mr. Collins. This is about whether you're going to choose to be the oppressors of the people, or whether you're going to act as the founders intended and be the servants of the people. The following prayer was offered in the United States Senate. It is good, O Lord, that it is not custom that brings us again into this sacred moment of prayer, but our deep sense of need. Forgive us all that we talk too much and think too little. Forgive us all that we worry so often and pray so seldom. Most of all, O Lord, forgive us that, so helpless without Thee, we are yet so unwilling to seek Thy help. Give us grace to seek Thee with the whole heart, that seeking Thee we may find Thee, and finding Thee may love Thee, and loving Thee may keep Thy commandments and do Thy will. Through Jesus Christ our Lord. Amen. And finally, at the last meeting, Linda Checkenow asked if she could get an answer to a question. Chairman Richardson then said, if you would like to leave a question with us, then we will have an answer for you. I would like to leave some questions with you.